Here's a brief anatomy of the spine. The spine is one of the most amazing structures in the whole of nature. It's built to be flexible, strong and durable, and it has to do all these three things at the same time. There's extreme versions of this in our society, such as Eddie Hall deadlifting 500 kilos, or people from the gymnastics arena or Cirque du Soleil bending themselves all the way backwards like contortionists. The spine is made up of three curves. There's the lumbar spine of the lower back, which curves inwards, which is called lordosis. And then there's the thoracic spine, which curves outwards in a kyphosis. And there's the cervical spine, which curves inwards again, just like the lower back, into lordosis. At the very bottom of the spine, you've got what's called the sacrum and the coccyx. These can be quite individual depending on person to person, and some people have more sacral joints or less sacral joints depending on who you are. These joints are commonly fused at different levels, and it's nothing really to worry about if yours are more fused or less fused than others. It's just a part of our evolution. We tend not to need that flexibility of the sacrum or the coccyx like we may have before. The spine is curved like this for a good reason, and it's to aid shock absorption. The shock absorption role of the spine and its curves are aided by the intervertebral discs in between the spinal joints. The bones on either side of these joints are known as the vertebral joints. Besides shock absorption, the spinal curves also have other functions. You'll notice in the diagram of the spine that the lower joints are a lot thicker and bigger set than the upper joints in the neck. This is because they're weight-bearing joints. They have to take the full load of the body and whatever weight the body's carrying in normal life throughout the entire period of this person's life. So they're thicker built, and they're the ones that are often damaged and degenerated over time. The joints of the neck are a lot smaller and a lot more fine. They have larger abilities to rotate and side bend than the lumbar spine, and this is for good reason. When you're looking left and right, you don't need to turn your entire body. You can just rotate the neck left and right, and you can also side bend it from side to side. Some interesting facts about the spine. The very top joint is known as the atlas. In Greek myth, we know that Atlas carried the sky, and this story was later changed to him lifting the earth because it kind of looked more cool in sort of sculptures and different things. World's Strongest Man trophy is of Atlas lifting the world, and that's the same as that top joint holding the earth on top of itself, the head. The one below that is called the axis, and this is because it's the joint that gives the neck the most rotation and it allows the head to look fully to the right and to the left. An axis, as we know in a map or compass, simply means to pivot. The spine, like other areas of the body, is built for purpose. You'll notice that it's almost like a jigsaw shape in the way that the vertebra below fits and slots in with the vertebra above. This is because of a thing called facet joints. Now, each vertebral joint has two pairs of facets. One facet is a superior articular process and one's an inferior articular process. This basically means that they knit together with the one below to form a synovial joint, and this lubricates that joint and lets it move about perfectly with less friction. Over time, these facet joints can wear and tear, and that lubrication becomes less, and so you get that sort of stiffening, aching feeling in some of the joints. This is known as facet irritation. One aspect of the thoracic spine in particular is that it has ribs coming off it. These ribs can be joined by a costovertebral joint or a costotransverse joint, depending on where the rib actually attaches onto the spine. We'll show you a diagram of this on the video. It's easy to think of the spine as a delicate structure that's sort of balanced on top of each other, like Jenga bricks. But it's actually a super durable, strong structure, and is supported by really thick soft tissues, such as the ligaments and muscles, to aid its stability and movement. Some of the ligaments include the anterior longitudinal ligament, which runs on the front of the vertebral joint and prevents excessive extension. The posterior longitudinal ligament that does the opposite, it runs on the posterior side and it prevents forward flexion to an excessive amount. You've got other ligaments, such as the transverse ligament, which runs between the transverse processes of the spine, and this limits that sort of side bending movement that you can get and protects any sort of subluxations of the joints and any fractures. We have a ligament called the ligamentum flavum, which runs from the cervical spine down to the lower back, and this goes through the spinal canal itself, that central foramina, which we'll talk about next. There's one more ligament called the supraspinous ligament, and this runs, as the name suggests, between the spinous processes of the spine. The sort of pedicles that you can feel as you press into someone's back. As well as the ligaments, you've also got the muscles of the spine. These are known as the erector spinae, and we won't get into them much now because we'll do a full video on them and their functions and ways of getting them strong. Moving on to nerves and foramens. Foramens you can think of as kind of train tunnels. They allow the big spinal cord in the middle to run through and then branch off into peripheral nerves. The main canal is called the vertebral foramen. This is a big, thick gap that lets the spinal cord run down. It also houses that structure we talked about before, the ligamentum flavum. This is useful because it allows the spinal cord some space to slip and slide in its sheath, and it also protects that spinal cord because, as you know, it's crucial to keep that safe. As we get lower down that central vertebral foramen, the spinal cord eventually reaches a level called L2, lumbar spine vertebra 2. From here, it spreads out into more nerves and branches off into what's called the cauda equina. This is Latin for horse's tail because of what it looks like. The last foramen we're going to talk about is the intervertebral foramen, and they allow the spinal cord to spread out and supply the rest of the body and innervate it with nerves. So these are little gaps in the spine, which you'll see here, which will allow those peripheral nerves to come out of the middle of the spine and spread around the rest of the body. So that's a very basic anatomy of the spine. There's loads to learn with the spine, and we're going to put out more videos that will hopefully educate people and tell them more about things like inflammatory conditions of the spine, traumatic injuries to the spine, and functional movements that we can do to strengthen our spines and make sure that those soft tissues described earlier are at their healthiest and most able to support the spine.